Hello everyone, it's your next door nurse Florence and you're welcome to another informative time. Today we're going to be looking into the topic sinus infection or sinusitis, what it is, some of its signs and symptoms, its causes, the types, and how to prevent it from occurring. And we're also going to be talking about what to do if it occurs before you get to the hospital. Sinus infection or sinusitis is an inflammation or swelling of the mucous membrane that lines the sinuses. Sinuses are small air pockets located behind the forehead, the nose, the cheekbones, and in between the eyes. The sinuses produce mucus, which is a thin and flowing liquid that protects the body by trapping and moving germs away. Sometimes, bacteria or allergens can cause too much mucus to form, which blocks the openings of the sinuses. The mucus buildup can become thick and encourage bacteria or other germs to build up in the sinus cavity, leading to a bacterial or viral infection. Most sinus infection or sinusitis are viral and they go away in a week or two without treatment. There are different types of sinuses in other parts of the body, but we're going to be focusing on the ones near the nose and the eyes, which is known as the paranasal sinuses. They are named after the bones that provide their structure. One is the ethmoid sinus, located between the eyes. 2 is the maxillary sinus, located below the eyes. 3, the sphenoid sinus, located behind the eyes. 4, the frontal sinus, located above the eyes. The biggest sinus cavity is the maxillary cavity, and it is one of the cavities that most often becomes infected. Sinus infection or sinusitis usually occurs after a person has had an infection of the ear, throat, or after a bad cold. The types of sinus infection or sinusitis includes 1. Acute sinusitis. This has the shortest duration. It refers to a sudden onset of cold symptoms such as runny nose, stuffy nose, and facial pain that does not go away after 10 days, or symptoms that seem to improve but then return and are worse than the initial symptoms. Acute sinusitis responds well to antibiotics and nasal decongestants. 2. Subacute sinusitis. These symptoms last for up to 3 months or 4 to 12 weeks, and it commonly occurs with bacterial infection or seasonal allergies. 3. Recurrent acute sinusitis. This term is used when the symptoms come back 4 or more times in 1 year and lasts less than 2 weeks each. 4. Chronic sinusitis. These symptoms last for more than 3 months or at least 12 weeks, and they are less severe. Additionally, chronic sinusitis commonly occurs alongside persistent allergies or structural nasal problems. Bacterial infection is usually the cause of chronic sinusitis. Anyone can develop a sinus infection or sinusitis. However, there are certain health conditions or risk factors that increases the chances of developing one. These health conditions and risk factors includes 1. A deviated septum. This is when the wall of the tissue that runs between the left and the right nostrils displaces unevenly to one side. 2. A nasal bone spur, that is, a bone growth in the nose. 3. Nasal polyps, which are usually non-cancerous growths in the nose. 4. A history of allergies. 5. Tobacco smoking. 6. Weak immune system. 7. Recent upper respiratory infection. 8. Dental or tooth infection. 9. Cystic fibrosis. This is a condition that causes thick mucus to build up in the lungs and other mucous membrane linings. The common signs and symptoms of sinusitis or sinus infection includes stuffy or runny nose, nasal congestion, tiredness or fatigue, facial pressure, particularly around the nose, the eyes, and the forehead, headache, pain in the teeth or ears, pain in the face above or below the eyes, halitosis, that's bad breath, decreased sense of smell, thick dark mucus coming from the nose, perhaps with a bad smell, fever, and cough that lasts longer than 10 days. The symptoms of acute, subacute, recurrent, and chronic sinusitis or sinus infection are similar. However, the severity and length of the symptoms will vary. How do you prevent sinusitis or sinus infection from occurring? Sinusitis or sinus infection develops after a flu, cold, or allergic reactions. A healthy lifestyle and reducing your exposure to germs and allergens can help prevent an infection. To reduce the risk, you can 1. Eat healthy foods such as fruits and vegetables. 2. Wash your hands regularly. 3. Cough or sneeze into your elbow. 4. Limit your exposure to smoke, chemicals, pollens, and other allergens or irritants. 5. Avoid exposure to those with active respiratory infection, such as cold or flu. 6. You can also get a flu vaccine shot in the hospital every year. What do you do when you have a sinus infection or sinusitis? You reduce the congestion by 1. Applying a damp, warm cloth or hot compress to the face and forehead several times a day. 2. Sniff nasal saline, that's salt in water, to help loosen the mucus. 3. Breathe steam from hot water to clear the nose. 4. Drink lots of fluid to stay hydrated and help thin the mucus. A sinus infection or sinusitis can trigger headache or pressure in the forehead and cheeks. Over-the-counter painkillers can help. If the symptoms does not improve within a few days, seek medical help. Sinusitis or sinus infections are treatable, and most people recover without going to the hospital or taking antibiotics. However, if you have recurrent sinusitis or chronic sinusitis, you could have an underlying medical condition, and if untreated, may cause rare complications such as an abscess, meningitis, orbital cellulitis, and osteomyelitis. So you need to seek medical help. So guys, hit the like button if you find this content helpful and useful. Please subscribe, click on the notification bell so you'll be the first to know when I upload new videos. Drop your comments in the comment section below and I will attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. See you